Hello everyone. Today we're going to be looking at heart failure. This is a presentation that's been provided to us by the Heart Failure Specialist Nursing Team from MPFT. So, what is heart failure? Well, heart failure is a term we use to describe symptoms that occur when your heart fails to pump as much blood and oxygen around your body as it should. The term heart failure can sound frightening, but we need to think of our heart as a pump which is not functioning to its full ability, and it's going to need a little bit of treatment and support for it to work properly. Now, what causes heart failure? Well, the most common causes are heart attack, high blood pressure, and cardiomyopathy, or diseases of the heart muscle. Sometimes these are inherited from your family, and sometimes they are caused by other things such as viral infections. Other causes include heart valve problems, alcohol or recreational drugs, and an uncontrolled or irregular heart rhythm known as atrial fibrillation can be a common cause of heart failure. Sometimes, however, we just don't know what the cause of the heart's inability to pump properly is, and I know this is hard to accept. The most important thing is to treat your condition and help to control your symptoms, as this will help to ensure a better quality of life and improve your life expectancy. So, what type of symptoms are we likely to experience when we have heart failure? Well, the main symptoms are shortness of breath. That's whether you're being active or can be at rest. Swelling of your feet, ankles, stomach and lower back areas, which when you press in leaves an indentation in the skin. And fatigue, or feeling unusually tired or weak. And also having to sleep on more pillows at night, or waking suddenly from sleep needing to sit up due to breathlessness. This can often be described as a feeling of panic. So, how is heart failure diagnosed? There are a number of ways of diagnosing heart failure. Blood tests. Your doctor may take a blood sample to look for signs of diseases that can affect the heart. Electrocardiogram or ECG. This test records the electrical activity of your heart through electrodes attached to your skin. It helps your doctor to diagnose heart rhythm problems and damage to your heart. Chest X-ray. X-ray images help your doctor to see the condition of your heart and lungs. Your doctor can also use an X-ray to diagnose conditions other than heart failure that may explain your signs and symptoms. Echocardiogram. Here, sound waves are used to produce a video image of your heart. This test can help doctors to see the size and shape of your heart along with any abnormalities. An echocardiogram also measures ejection fraction, an important measurement of how well your heart is pumping and which is used to help classify heart failure and guide your treatment. Coronary angiogram. In this test, a thin flexible tube or catheter is inserted into a blood vessel at your groin or in your arm and is guided through the aorta into your coronary arteries. A dye is then injected through the catheter to make the arteries supplying your heart visible on an X-ray, helping doctors to spot any blockages. When we're looking at treatments for heart failure, with good management of symptoms and the right treatment, many people with heart failure can lead full and active lives. A combination of medications tailored to the individual will be the first line of treatment. Some patients may require cardiac devices such as implantable cardioverter defibrillators or ICDs. These are small devices which can treat people with dangerously abnormal heart rhythms, or they can be offered as a precaution against this. Pacemakers are small electrical devices which are used to treat some abnormal heart rhythms that can cause your heart to beat too slowly or miss beats. Some pacemakers can also help the chambers of your heart beat in time, or resynchronization therapy. Lifestyle changes are equally as important as cardiac devices. Smoking increases the workload of your heart and decreases the amount of oxygen that can be carried in your blood, so it's essential to quit. Keeping active is also incredibly important. Again, this can be tailored to your individual needs. Activity will raise your energy levels, reduce your stress, and overall improve your general well-being. A healthy, well-balanced diet is one of the most important things to have. Reduce the amount of salt. Always avoid low-salt substitutes, as these contain higher potassium levels. Keep alcohol to the recommended limit, and make sure that you maintain your fluid balance. People with heart failure are normally advised not to exceed 2 litres per day. There are also a number of medications used in the treatment of heart failure. Diuretics or water tablets, such as furosemide or bumetanide, are used to help you pass more urine and help relieve ankle swelling and breathlessness caused by heart failure. Your GP or heart failure nurse will educate you around self-adjusting this according to your symptoms. Angiotensin-converting enzymes or ACE inhibitors, such as ramipril or perindopril, help to lower blood pressure. They do this by having a relaxing effect on the arteries, which reduces the workload and therefore helps the heart to pump better. ARBs, or angiotensin receptor blockers, work in a similar way to the ACE inhibitors in treating high blood pressure, but they do not cause the side effect of a dry cough. Sacubitril valsartan, more commonly known as Entresto, is a new class of drug called an angiotensin receptor neprilysin inhibitor, or ARNI. These work by relaxing blood vessels so that blood can flow more easily, which makes it easier for your heart to pump the blood to your body. Beta blockers such as bisoprolol or carvedilol are used to lower your heart rate. They do this by blocking the action of hormones like adrenaline, and this helps to reduce the work the heart has to do. Mineralocorticoid receptor agonists, or MRAs, such as spironolactone, have a mild diuretic effect, which means they help to get rid of excess fluid. However, always check with your pharmacist before purchasing over-the-counter medications, as these may interact with your prescribed medication. Self-care management tips. Weigh yourself daily and report any sudden increases of 1 to 2 kilograms over a 3 to 4 day period. Sleep pattern. Report any sudden changes, sleeping on more pillows or waking during the night. Remember your fluid intake. If advised, keep to the restriction, normally 2 litres per day. Salt intake. You need to reduce this where possible. Exercise tolerance. Think of setting realistic goals. Remember, out of reach, but not out of sight. And flu and pneumonia vaccines. Please make sure you keep up to date with these. Heart failure is a roller coaster. You will have your ups and you'll have your downs. If you have any concerns, please contact the team immediately. Thank you for listening.